today marks World Children's Day. World Children's Day is UNICEF's annual day of action for children, marking the adoption of the Convention on the Rights of the Child. The Nelson Mandela Children Fund is set to launch the State of the South Africa Child Report 2023. So the study centers around the following challenges: child poverty, including health and nutrition, education, housing and household characteristics, and child safety as well. So to take this discussion further, we're going to be joined by teams by Save the Children South Africa CEO Gugu Xaba. Gugu, good afternoon, and thank you for your time with us here on the SABC.
Good afternoon, and good afternoon to your listeners.
Given the report that will be unveiled, perhaps you could speak to the state of children in South Africa and the impact that poverty, child poverty, is having on children's well-being at large.
Thank you very much for the question. I'm sure SABC would agree, and South Africa as a whole would agree, that when a child is born, we have a responsibility towards that child. And if that child is born where there are no clothes and there's no food, we have an inability to help that child to survive. And what we have seen is that our malnutrition as a country begins with the pregnant woman, and it gets on to the child that is born, who ends up being malnourished. That is why 1 in almost 4 children in country are malnourished. That says the poverty, the inequality that we are seeing out there is directly affecting children, and is also going to cause us not to attain the sustainable development goal of good quality health. And you know that as soon as there's an inability to eat, there's an inability to learn, there's an inability to be in a safe environment, because what ends up happening, we have seen that we've got high teenage pregnancy, and there's a lot of transactional sex that is happening simply because children are trying to get themselves to have some food. So we do have a serious problem, and we need to attend to the poverty levels and the inequality that we are seeing for us to be able to raise children that can reach their full potential. Thank you.
Absolutely. Thank you for those opening remarks. Given the information that's also come to the fore, what are some of the stigmas that are associated as well? How do we begin to dispel and avoid some of these stigmas? What challenges and concerns also arise on that front in relation to children and their well-being at large?
Okay. Let's take an example of the very issue of poverty. The stigmas that we are facing is that as long as we have inequality, it means we have a society that is divided. And that division causes us to even be violent against each other because of the different classes of people we have. And again, when you sit with children that are always in lack, it means, one, we're not developing them cognitively, and it also leads to low self-esteem. It also leads to the fact that we've got more, and we've seen the increase in mental health problems that are coming from the fact of not having and having. And the other thing is that we've seen even an increase in suicide. The suicide may come from the fact that people have no jobs, people are in lack, such that even adults feel, I cannot provide for my family, so what's the use of me being here? So it just compounds the problems that we have, social ills that we have as a country. And so there is a need for us, and we are saying, from communities, we need parents that are engaged, we need children that are engaged, so that we can be able to deal with that problem. Take an example of when we do have an ability to have just home gardens, it means we are moving a step ahead towards dealing with lack of food in the home setting. But now, if there's no water, then we have a problem. So thus, the multi-sectoral platform needs to work together in order to ensure that we provide the resources, we reduce the challenges that communities are facing. Thank you.
Gugu, the efficacy of social assistance programs at this point in South Africa and the level of social spending on children in South Africa also coming to the fore. What was observed on that front? And when we look at some of the recommendations, whether it's on policy, on the level of policy, what are some of those indicators that are coming to the fore, the principles at large, to dispel some of the stigmas and correct this problem for our future labor force, or the future of our country?
Okay. One thing that South Africa has done is to provide the social support, which is good. Now, the challenge is that our communities have been provided with resources, at times even without education, but at times without supportive structures. Take an example where the social grant is provided to a girl that is 18 years old because she's got a 2-year-old child. And this is a person who believes they are lacking all other things that her peers have, and forgetting that she has a child that needs to be supported. Then what we have seen with social grant is that it could be used better, but it's not used the way it should be, which is a challenge again for us as in development to say the communities that we are providing resources to still need to understand why policy is changing, why policy is providing these resources so that these resources can be used properly. But again, the other problem we have is that we've got children that are born and their fathers are alive. Their fathers are earning far, far more than the 500 rand that is given by social grant, but they're not contributing to the development of their children, which means we also need a system that finds the fathers, because a lot of them are alive. And so you see, the social ills have a bad cycle that we need to deal with. But I'm glad that we've got a men's parliament that is talking about some of these things, to say fathers must start taking responsibility and being accountable to support what government is doing. And we can be able to get better results from what has been availed, because there's a lot of money from taxpayers that is being provided for social services. But the problem is how it is used to benefit the very child.